Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Okay, Jill, tell me what's going on with your shoulder.
Okay, yeah, well, about 20 years ago I had a tennis injury on my shoulder, and it was very painful at the time, so I stopped playing tennis, stopped doing a lot of things with my right arm. And then I kind of exacerbated it about a month ago. I was carrying some really heavy bags for too long, and it just locked up, and it's been kind of a problem ever since. A lot of
20 years. Okay.
Yeah, 20 years, and really, really bad the last month. I really irritated it.
So last month, what did he do?
I was lifting some heavy bags and walking.
And walking.
Yeah, and it started burning in there, and then the next day it started really.
So for the last 20 years, can you tell me what kind of treatment you have?
Actually, for a long time I didn't do really anything, and then about the last year and a half I started doing physical therapy, thinking
So you did physical therapy.
four different physical therapists.
Oh, 4 therapists.
And every time I'd go, it would just make it worse, seemingly. And so I started doing kind of some exercises on my own, and it started actually getting better. And I was playing tennis. I wasn't serving. And then this happened. Yeah.
And any other treatment? I know you are acupuncturist.
I'm an acupuncturist. You know, I had some acupuncture. It did seem to help. Chiropractic didn't, ever seem to really do much for it. So I just kind of worked around it.
Okay. Did you do any massage on yourself?
It's right here in the joint. So it was no, not really. Yeah.
So can you describe the symptoms you're currently experiencing?
Sure.
What kind of sensation, how much pain from 0 to 10, and what caused more pain?
Sure. So it's pretty localized. Sharp stabbing pain right here.
Okay.
And then as it's gotten more irritated, I'm feeling it up in this area, and also and also underneath the scapula on the right side. It gets really achy and pulley. So it kind of comes and goes and moves around.
Okay.
I'm not in pain right now, but if I move my arm at all, it does create pain.
So that's what aggravates your symptoms when you move it. Okay.
Yes.
So we're gonna do certain, like the motion that aggravated, to use it as a way to reassess your response to the treatment.
Okay.
And I want you to let me know from 0 to 10 how much pain and where do you feel the pain.
Okay.
And also I want to know, is your pain superficial or deep in the joint?
Deep.
Okay. So let's actually do thumb up and bring it up like this, and stop when you feel pain.
Right here.
Okay, so that's almost like 45 degrees. How much from 0 to 10?
Like a 5.
And you feel it in the front, yeah?
Right here, yeah.
Okay, let's do thumb up like this and bring it up this way. It's almost the same. You're almost 90 degrees. Yep, okay.
Yeah, it's pretty bad.
How much from 0 to 10?
Like a 6.
6, okay. Let's have you do this. Can you do this? Okay. So is your pain more when you get to that motion or when you lower it down?
Kind of both.
Both? Okay.
More this motion, but also lowering it down.
Okay, so 6, and this how much it was in the front? You were able to go further now when you
maybe just warming it up. Yeah.
Warm it up.
Well, it starts hurting right here.
Okay.
And it's like a 4.
So it's catching in the middle and then clearing?
Yeah,
is that what's happening?
It kind of changes, but I think the more I do it, it kind of does warm up. It's pretty stiff in there.
Okay.
And then it starts hurting right up there.
How much from 0 to 10?
Up here?
Mm-hmm.
Like a 2 to 3. Not terrible. Just kind of burning in there. Yeah.
So let's go back. How's that?
It's not terrible. It was pretty difficult to do before, but it's getting better. Yeah.
So let's do the side. Thumb up.
I didn't see that.
Thumb up and bring it to the side. Okay.
This is the worst one.
This is the worst one. Okay.
I think so. It's hard to do.
So this is the one that, like, even after warming up, you're not able to go.
Yeah, this is actually pretty darn good.
So let me measure your range of motion. Lying down, so I will have your head lying, head over there. We're gonna stop when you feel pain, so just gonna take a few numbers here. Do you have any medical history of head trauma, accident, anything like that? So
just when I was around 10, 11 years old, I flipped over my bike and landed on my jaw.
You landed on your jaw?
Right, my chin, sorry.
Okay, and what, do you have any symptoms after that?
I've had, in my early 20s, I started having a lot of occipital
Headache or pain?
Yeah, pain and a lot of neck issues and a lot of chiropractic as a result.
Okay.
Right there, yes.
Right there?
Yeah.
So your range of motion here is actually 150. Sorry.
That's okay.
It's 150. So your flexion is 150. Remember the numbers. Will be in the test. Okay.
I won't remember.
All right.
I can
So
guarantee
abduction. Let's see. So abduction, that's the limited one, is 120. 120 abduction. Hope you're able to see it. Okay. So abduction is less. Normal range of motion should be 180 both ways. Okay.
Okay.
So flexion 150, abduction 120, 110. Sorry. So bring it down this way. Oh, listen. So internal rotation. Let's bring it down. Oh, yeah, that's normal. Okay.
Going back is hard, and the last PT I went to had me doing these exercises, and I think it wasn't such a good. Yeah, right there.
Okay, so the internal rotation is fine. External rotation is relaxed. It's 44. So internal rotation is 44. So internal rotation should be like 70 to 90. I'm sorry, external rotation and internal rotation should be the same, but your internal rotation is fine. So the limitation is flexion, abduction, and external rotation. Okay, everything pain-free. So when you had that accident, you said you landed in your jaw like this?
Yeah, I flipped over the handlebars of my bike and landed on my chin. And I had braces on. The braces got pushed up into my gums, and I had stitches under my chin.
Okay, all right.
But I was 11 years old then.
Okay, we're gonna start working on the shoulder now.
Okay.
And we'll reassess your range of motion. If we get the range of motion, great. If not, I'm gonna work on your chin and your head because that accident caused fascial restrictions in the jaw and the head area. And because the superficial fascia wrapping the entire body, that could compensate and your shoulder. Yeah, one of the questions you had before this, because you watched the video before, is can you do the fascial release using your hand? And that's a really good question. It's hard to do it with the hand because you're not be able to grab. You're not going to go deep. So that's why I invented this design with the rubber. So it's really can. Well, fascia is like very thin layer under skin. The superficial layer is wrapping the entire body. It's like it's actually thinner than the gloves. That's wrapping everything. So when you have any accident, trauma, or poor posture, poor body mechanic, you start to have like injury to the fascial layer. Your body starts to build the scar tissue, and instead of it's nice and loose like this, it's get tight. So when you have fascial restriction, it's like you're wearing a t-shirt 2 to 3 sizes too small.
Okay.
So it's actually like it's kind of suffocate everything underneath it. And that's what I try to release now. Okay, so I want you to move your neck left and right and tell me how.
Like this?
Yeah, how that feels. That's a little tight here.
Yeah, I tend to not have too much problem there.
Okay, extend and flex.
The side to side is.
Let's do side to side.
I don't think.
That's limited.
I don't think anything's happening.
Oh, you're not really moving this way. Wow, that's really tight.
But this one is even more, yeah.
Yeah. Let's turn this way. Okay, I want you to remember how far you can see.
This one?
Yep,
Okay.
and the other way.
That's a little bit more.
We can compare it and how far you can go back. And down.
Okay.
And let's do again side to side. And the other side.
Okay.
Because I'm going to work on the neck at the same time.
Okay.
If you're purely in a perforation stage in the neck, that's probably going to clear up faster than if you have inflammation.
Okay.
So I'm going very deep in the trap area. You have a really deep scar tissue there and deep fascial restrictions. So I will never be able to use my hand to really go that deep. That's why I'm using the A5 to really get there and really release those tight area. because mechanically impossible. Like the technique we learn in school, you use your knuckle or your elbow,
Right.
which is very thick. That's not really gonna go deep as this tool.
Yeah, and having that handle on it really allows you to use your body weight to get some pressure.
Mechanically, like you're really exerting less force than,
Right.
you know,
That's great.
using your elbow. And the other thing is, your elbow never gonna go that deep because it's very thick. You know,
Yep.
I had several massage therapists and PT and chiropractor. Actually, a couple of them actually was 69, 70 years old.
Oh, really?
And they came to
Wow.
take the class, and I was like, the first question I usually ask, like, what made you sign for the class? Guess what their first answer? My hand
Oh, good.
I'm
Can't-
ready to retire
Yeah.
because I cannot
Can't
do
the-
physical
Yeah,
work.
yeah, it's hard on the hands.
So I follow up like several weeks after that, after using the tool. What they say? I'm ready to continue working.
Good.
This is really not
Good.
aggravating any symptoms for my elbow or my hands.
Good.
Now I have like even athletic trainers and personal trainers.
Oh, yeah.
They take the course,
Yeah.
like instead of doing stretches or something like that, they just
Yeah.
release that area, you know.
Yeah.
So it's really applicable in a lot of field because it's related to
Sure.
musculoskeletal,
Right.
which a lot of healthcare practitioners like working on those areas. But you see how easy, like you really can use your forearm.
That's
You really
amazing.
don't need to really exert a lot of force.
Yeah, that's great.
Use your body weight.
Yeah, that's great.
But if you're using your hand, you're just gonna,
There's no way you can dig it.
you know what I mean?
Yeah, I try to get in there with my fingers. It's kind of nervy going down into my shoulder.
Oh, you have a lot of inflammation there. Okay. So that's another way to know how bad is your inflammation if you're not tolerating the slight pressure.
Yeah.
Okay, your occipital fascia is very tight. So normal fascia movement should be like this. Let's show it in here. You see, look at my hand. You feel the mobility here? That's in most of the body should move like this. Some areas in the head and the hand and here, it's not going to be as mobile as this. So that's a way to know how the normal range of motion for the fascia.
Okay.
So when I do like area like here, and I'm like not really moving that much, like around like half an inch to an inch, I'm sorry, centimeters. That means it's restricted. Feel that? Not moving much. And here is like a rock. It's like your fascia is so tight to the point that is no movement and it's just compressing when
You
everything
just feel it with
under
your
is-
fingers. Just
Yes, like here you feel like, what I feel is actually there's no fascia, I feel like it's part of the skull.
Wow.
It's just one piece with the bone.
No wonder I have a lot of headaches.
Not surprised. You know what I mean? When you have it tight like
Yeah,
this, it's
yeah.
like you
Yeah.
wearing a face mask or a head mask
That's what it feels
or
like.
the face mask that's actually suffocates
all over my head.
You know what I mean? So that's what I feel. Feel that here? Do you feel the tightness? Okay. So that mobility is not even like 1 centimeters moving. So that's why I need to release that. Why this could be important in the head? Because the superficial fascia grabbing the entire body. If this tight, it's gonna pull.
Okay.
You know, like for example,
Makes sense.
if I have the tightness in the fascia in the back down here, the front is not moving.
Okay. Right.
So it's one of the things that's overlooked because it's hard to release it with hand. And it's hard to assess it too. You know what I mean?
Yeah.
If you don't have tools that go deep to assess it
Yeah.
and to release it, it's basically you depend on your hand that's only touching the superficial layer. What about the deep layer?
Yeah.
You cannot get deep with your hand.
Yeah.
That's why it's overlooked. And it's part of the musculoskeletal injury.
So now you're doing this with your hands as opposed to the instruments. Is there a reason?
because the position now, but it's easier to use it with the.
You could do the tool if I was sitting up or something.
Yeah, I'm just trying to save myself time.
Okay.
Like mechanically, it's better with the tools. And you had really a good question because you acupuncturist. So you said like the adhesion in the fascia or the scar tissue could decrease the energy flow.
Right, absolutely. You would think.
So that's another way to tell which area has more inflammation. When we release several areas, and like one area is just took one treatment, two treatment, and that's okay, you're back to normal. Other area is taking a little bit longer, so we know there's more inflammation. We need to really be aggressive on addressing the inflammation in that area.
Okay. I just kind of want to see what are you pressing on the body? What part of it?
It depends on the body part. That's why I designed it. I designed it with different shapes to match your body part.
Okay.
So this way I work.
So can you just show me here, like when you're doing it?
Okay, so so big curvature. This
just
is
kind of like that.
snugged in here. Okay.
Okay.
Look at your fingers.
Ah, okay. So,
Work smart, don't work hard.
okay.
You know, it's matching your body parts. So this way, for healthcare provider,
So you're going with this part in there.
any part
And the-
of
on the
these, I
outside- on the
designed those
outside.
like the whole area.
And you put the
can-
lotion kind of right in there. Okay.
Yes.
I feel good.
Let's move your neck first
Okay. Okay.
and see the range of motion and tell me how's that.
I think that's much more.
You're going further.
I'm getting to that.
Oops.
Sorry, to that corner. I don't
Yep.
think I was at that corner. Yeah, definitely better.
Extension.
Hard to say that's that much better. It's probably about the same.
Okay. Your extension and flexion
Not
is
too bad.
not very limited.
Not too bad.
Yeah, the limitation is the side bend, left and right. Okay, go a little bit further.
A little better, maybe.
Where do you feel the tightness when you do that?
Come in here. I mean, I don't really feel. It's no pain. It's just limited. So I feel
But
it pulling here.
Guess what?
What, huh?
You at least 50% more here.
Okay.
This is the one like you really barely
Yeah.
moving it. Okay, you felt it where? In a trap or somewhere else?
I feel it pulling here.
Mm-hmm.
Not just a little pulling. This side. And the same thing. Just pulling here. Just pulling.
Just pulling.
Just pulling.
Okay, but you feel more mobility?
It's hard for me to tell.
Okay.
Only a little bit.
Mm-hmm. So let's move your shoulder now.
Okay.
It was the flexion and abduction we had issue with. So
All right.
let's try thumb up and bring it all the way up and tell me how that feels.
In front here.
Mm-hmm.
Feel it here. It's pretty
It
much.
was 6 before. How much is now?
Going like this is probably like a 3 to 4. Probably like a 3 to 4 up there.
Okay, so went down to 3, 4. Sum up and bring. This was the challenging one.
Yeah, it's like a 4, 5 in here.
Okay. Okay. So because you had that injury here, is it okay to work on your
Sure,
jaw?
just-
No, but you feel the grinding of the scar tissue.
It's just weird.
It feel like I am actually like the tool over
Little rocks.
rocks, not sand. Sand is very small, gravel.
Yeah.
So here's the thing: when you have a scar tissue, your muscle should act like a rubber band when you contract and relax, stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it doesn't really goes much.
Right.
So the clenching at night, there's a lot of. It could be stress. One thing, it's bad habits. We have to work on all of that at the same time. Positioning, the way you sleep at night, because some positions they actually promote more clenching. So when I work with patients with the TMG, we really have to go all through all those triggers to figure out which one is applicable to patient. Yeah. So let's do the rotation, move your neck. How's that?
It's even more.
Going further.
Further.
Yeah. Mm-hmm.
Yeah, even more.
That's your normal range of motion, by the way.
Okay.
That's your max.
I never realized I was that
I don't want you to
go
like,
more. That's perfect. Yeah.
Yeah,
Okay.
we're not an owl. So I hope not. So let's extend. How's that?
Feels good. Feels looser.
So one of the things that a sign of gaining more range of motion is the speed of movement. So if you're moving faster,
Okay, makes sense.
so things start to clear up, you know. When you move slower, you're really pulling on that scar tissue.
So when I go here, I do feel down my spine.
Where in the spine?
At the upper thoracic.
Well, you feel it
A
here?
little bit lower.
And here?
Yeah.
Okay. So let me get. Okay, let's check your shoulder.
Okay.
Okay. Flexion.
Is this flexion?
Yep. Perfect. And you tell me
So
from
I
0
feel
to 10.
I
how
feel
much?
it right here. It's probably like a 2.
So when down to 2, we start with 6.
And probably like a 2 to 3 up there. I feel it in a little different area, more in the muscle than in the joint. Yeah. And then you want me to do this one?
Yeah, you're moving a lot faster
A
now.
lot faster. Yeah. This one. So still right here, like a 3, 4.
Okay. You're going further now, huh?
Yeah.
Good.
I think it was like that before.
Mhm.
It's just restricted. Again, it's not so much here, but more in the muscle. So it seems like it's
Where exactly now?
right kind of here. I feel just tightness.
Do you feel it deep or superficial?
Very deep?
Deep. Okay.
Yeah.
Right in the spine, yeah?
Yeah. Just right on either side of the spine. All right.
Right in here?
Yeah.
So it's paraspinous. Yeah, right in the muscle. Okay, so we can see the scar tissue here in that area. Is it too much?
Nope. Feels good.
Flame, if you have an open wound or cut, do you massage it?
No.
You inflame it.
Right.
So any light pressure,
Right.
that just make the whole system scream.
Okay.
Let's move your neck left and right, and
Feels good.
we do
good.
backward. That's a 4 range of motion, flexion, extension.
It's still pulling a little bit, not as much. It just feels a little tight in the
Good.
back, but not too
Okay.
bad. Yeah.
Side bend. How's that?
Yeah, it's pulling here, but
Okay.
you know. I don't really feel pulling on this side at
Good.
all, but more pulling on this
But
side.
you're going a little bit further. Okay.
Okay.
So flexion.
So right here, it's kind of catching.
0 to 10. The catching, that means you still have some scar tissue. Sometimes you take a few treatment, you can continue working on yourself.
Okay.
I'm talking about the pain. If catching, you
It's
still
pain.
have some
It's
work.
pain.
0 to 10.
It's like a 2 to 3,
Okay.
right in there.
And go up.
And going up, it's about the same, and
Mhm.
it's tight. It's tight on the top. Yeah.
But you're not getting to 6, yeah?
Yeah.
Okay. Let's do the side. Come up.
So right in here, like a 2 to 3,
Mm-hmm.
right there. It
Mhm.
just kind of gets tight.
Mm-hmm.
Definitely better.
So that's inflammation because the last thing I used is a magna heel.
Yeah, definitely better.
You're going, the speed is improving.
Yeah, it's tight up there, but
Mhm.
feels.
If it's a mild inflammation, it should take 2 minutes with the magna
Mhm.
heel. Severe inflammation, you probably need to wait.
To wear it.
To wear it for several hours a day. One of the common question is how long are you gonna wear it? I'm like, depend on how bad is your inflammation. Some patient 2 days wear it for 6 hours, that should be enough because they have kind of moderate inflammation. If you have severe inflammation, it might take you longer to use
So
it.
when you say wear it, you put one on the front and one on the back?
No, well, if you're gonna use one, you use one.
Oh, just one, when you're.
Where it comes with the ace bandage, or you're
Oh.
gonna strap it in your bra
Oh,
or
okay.
something
So
like
you
that
just-
in your clothes, and you just rotate it where you have inflammation.
So every 15, 20 minutes, you just kind of
Yes.
keep moving it around?
Yeah. So, but for healthcare provider, we
Right.
usually recommend we use this too because I'm already like get deep in the joint
But you don't really need the two of them
for self-treatment.
to create the
Yeah.
energy movement.
So for it's kind of like faster, double the dosage compared to
Right.
single
So for
dosage.
me, since it got better, you would say it's milder inflammation, or
You moderate. to-
moderate?
Yeah, kind of moderate. If it's mild, that's mean 2 minutes you're done.
I'm not quite there yet,
No.
but yeah.
No.
But it did help.
Yeah. So another thing, I had patient. They notice when they wear it, they able to move a little bit faster. So when, like, throughout the day, they just wear it, so this way their mobility
It's a big thing
is
to be
improved.
wearing, well, I guess.
Well, I'm coming with, like, in 4 months, really,
A smaller?
a version with the belt.
Oh, okay.
You really can strap it on, like, it's really...
Yeah.
So
Because you probably don't need this part, do you? Or you do?
for healthcare provider,
Healthcare,
you need that,
yeah.
because how you gonna...
Oh, got
do
it.
the-
I got it, okay,
You
yeah.
know what I mean? It's a,
But if you're, for the patient, they can just put
For
it
the
on.
patient, and some patient, they just continue doing this.
Mhm.
But if you really do it, it's faster when you move it,
Mhm.
you know, than the
Mhm.
static.
Mhm.
But it does not matter, because if you do it static, just to have it for longer time, just leave it there.
So having the one in the back, I would assume is stronger because it's
Each one, the length of the magnetic field is about 2.5 inches.
yeah.
So I'm actually,
So you're getting two treatments in a way.
so I can penetrate 5 inches
Right.
inside.
Right.
So this way I'm actually going deeper.
Deeper.
For a healthcare provider, you really, if someone has really, you want to get deep,
Deeper. Got
so
it.
you want to really do this.
Got it.
But for patient, you're going to do 2 inches here,
Mhm.
and then you're going to rotate it 2 inches here, 2 inches here. It's about time. You know, and in the clinic, you know, you just want to get stuff done quickly,
Mhm.
get
Got
to
it.
the fast results, so you don't want to have the patient
Got
sit
it.
for an hour or 2 hours.
Got it. And so then if I wanted to put this, I would just kind of put it on with an ace bandage, just not kind of the area that's.
Yeah, I had actually acupuncturist. She worked with other tools,
Mhm.
and she had a patient had bruises,
Mhm.
and while she's doing the acupuncture treatment in the upper body,
Mhm.
she just put it in the bruise.
Mhm.
I think she said like 5 or 20 minutes,
Mhm.
and the circle from the magnet, that area was look normal skin compared to
Mhm.
the bruises around it after 20 minutes.
Mhm.
She was doing it while she's doing the
Therapy on the other.
therapy. So you can, like, if you have a patient with like several issues, just
Put the magnet somewhere else.
but
Yeah, it's just kind of in
0
here.
to 10.
Like 2 to 3.
Okay.
It's kind of the same.
Okay, let's do the side.
Okay.
So that's a sign we need to really
It's about the
use the
same.
magnets a
Yeah.
little bit. Your range of motion for flexion was 150. Okay.
Okay.
So flexion, go back.
Okay.
Mm-hmm. And now is 175.
Oh, cool. Good.
Okay.
That's wonderful.
So 175. So 25 degrees. Okay. Abduction was 110. Okay. So let's go back. Guess what? Okay. How does that feel?
Probably there, yeah.
Okay, 135.
Good. That's,
So we still have some work to do. Definitely there's moderate to severe inflammation there.
yeah.
So external rotation was 44, okay? That's going backward. So can you go backward? Look at this. Are you trying to show off with this one?
What's this now?
Now it's 70.
Good.
That was 44.
Good.
All right, so let's set up for me.
Okay.
I want you to move your neck again and tell me how that feel. That's nice.
Good. Definitely better. A little pulling, but not bad.
Mm-hmm.
I think that's better.
So from provider feedback
Yeah.
perspective,
Yes.
what do you think about ASTR treatment?
Well, I think it seems like a pretty easy way of creating some change and relieving pain and opening up the fascia and doing some deep work without killing yourself. And
Mm-hmm.
yeah, so I think there's a lot of potential positive aspects to it, including it in any kind of physical treatment.
Nice, awesome. Thank you.
Thank you.
Thank you.
Thank you. Okay.